Caregivers Burnout. I'm glad to welcome Dr. Vijay, Assistant Professor Geriatric, Psychiatric Unit, Department of Psychiatry, NIMHANS, who is leading the session today. Welcome you, sir. I also welcome today's moderator, Ms. Annie Matthew, on introducing. She is a student counseling psychologist, and she worked as a quality coach cum behavioral skills trainer with the GE's BPO division in Hyderabad. She is currently interning with NIMHANS and pursuing her MSc in counseling psychology from MICU Shillong. She also had experience of counseling the youth and young married couples for over 6 years in the church setup. Welcome you, ma'am, for this today's session. I also welcome all the participants for today's webinar. Over to Ms. Annie Matthew. Please, ma'am.
Thank you, Lima. A very good evening to everyone present here, respected Dr. Vijaykumar, each and every participant here, and my friends at Vayomanasa Sanjeevani project of NIMHANS. I extend a very warm welcome to all of you for today's session of our webinar series at Vayomanasa Sanjeevani. Today's session, as you all know, is on a caregiver's burnout. Who is a caregiver and what is burnout? Just to set the stage for the talk today, I'll just share what the dictionary says about these two terms, and then we'll go on to listen from our expert. According to the Merriam-Webster dictionary, a caregiver is a person who provides direct care, as in for children, for elderly people, or the chronically ill. This could mean a mother, a nanny, a nurse, an attender, or even a friend or an acquaintance who's just willing to help. According to the same dictionary, burnout in our context means exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. Anyway, those were just layman's understanding of these terms. Let's now move on to listening from our expert. To speak with us on the topic of caregivers burnout today, we have with us Dr. Vijaykumar Harbishettar. He is currently the Assistant Professor of Psychiatry, the Geriatric Unit in NIMHANS. He's also the Editor-in-Chief of the Journal of Psychiatry Spectrum, that is of the IPSKC. He brings with him 22 years of experience in psychiatry, 8 years of training in NIMHANS and in the UK. He's been a consultant experienced in Birmingham in the UK and also at NIMHANS. His interest is in dementia, geriatric mental health, delirium, and sleep disorders. He's written over 120 public awareness articles in newspapers and magazines. And he's also written 40 scientific papers with PubMed index of 11, total citations of nearing 900. Wow, that is quite an illustrious career. Thank you so much, sir, for taking time out and coming to speak with us. So without taking any more time, over to you, sir. Thank you.
Thanks, Madam Ann, for introducing me. It's my pleasure to be here and discussing this interesting topic and very important, I believe. Good that you set the scene by discussing the dictionary meaning of caregivers and burnout. For our discussion purpose, for caregivers, when we say caregivers, it means I'll restrict only to the family caregivers for the time being for this today's discussion, who are providing care to the chronically ill or ill people. I just wanted to check if there are any caregivers in the audience. You can put your messages in the chat box, and while I'm continuing to talk, you may be able to put your views and comments in the chat box. That will help me, and I can take the discussion, around that issue. To help the audience, because this is more of an interactive than a didactic kind of a discussion. Like it's not a lecture. Okay. Okay, right. So as you all know that today also I'll be restricting mostly to the elderly population. Again, when I say elderly population. So aging comes with so many issues along with that. As you all know, the physical health issues, people will be on number of medications. I won't say everyone, but many. There will be frequent visits to hospital for consultation and tests. They may have sensory decline. When I say sensory decline, I mean hearing issues or visual impairment and visual decline, then slowness in activities, then mobility will get affected. There are some financial issues because they're not able to go and work like the way they used to work as adults. There could be mental health issues. Again, aging is a risk factor for mental health issues like depression, then dementia, then caring despite being unwell. So if the spouse, if the person has got an illness and a spouse is taking care of this person, spouse may also be, the caring person may also have some kind of a problem, any of these again. So being an elderly caregiver has its own challenges, unlike the adult caregivers. So there could be two categories here. One is elderly spouse caregiver or a adult child caregiver. So one of the children's of the patient may be caregiver. So the caregiving may be for chronic illness like multiple sclerosis, Parkinson's disease also. Let's not get into the negative side of caregiving. There are positive side also. So it just tells you that there is a bonding, there is affection, that I am taking care of you. I'm related to you. It's my duty. It's fulfillment that I'm doing something for my family, for my father, or for my mother, or for my spouse. So they take pride in it that I'm doing my job. Then you have the best. Usually, the family members are the best people to take care of when a person has illness. It's difficult for any professional paid caregivers to look after. So compared to professional caregivers, it is the family caregivers who are the best people, ideal people, who knows this person, who knows this person's behavior, who knows this person's personality. They are the best people to provide care. And there's a sense of gratitude. Then this prevents hospital admissions in many cases. If there are good caregivers who can look after even at night, a hospital admission can be prevented even. Saying that, okay, if something happens at overnight at 12 o'clock in the midnight, I'm going to take you to the hospital. You don't worry. I'm there to look after you. You be at home. You do this, as the doctor said, you do these things, and I look after you. And in some countries where the treatment is the care is the medical care is provided by the government. For example, in NHS in UK, there it saves the cost for government also, and that's why caregivers are very important for the government of UK. And they are very thankful to the caregivers. And even caregivers, if they are stressed, they can walk in and get counseling, just like, and even get admitted even for if they have any problem, their own problem, to get help. Okay, I'll discuss few cases. In this case, there are two cases at least I've come across in the last 2-3 years. The son could not get his fertility treatment. He was not able to have babies and kept deferring plan to go and seek fertility treatment. This is because mother had dementia with behavior problems and was aggressive. And this son could not have paid caregivers at home to look after because the house was small. There was financial issues also. The son was working in IT. When son had gone to work, daughter-in-law was looking after the patient. So they did not think getting the fertility treatment for them to have babies was so important. They got drawn by the fact that they thought it is their primary duty to look after mother. That's one case I just want to mention here, just to give you an idea what we are discussing about. Caregiver of a person who had chronic cancer and had suffering dies by suicide. This is a newspaper report. I don't know whether you had a chance to look at it in Times of India about 4 years back. It was there, very clear. And this also led to people thinking that there should be some kind of counseling directly should be available for caregivers of these cancer patients. Case 3. Caregiver developed depression, caring for a person with dementia with behavior problem. Caregiving spouse, despite knowing the problem, decided to stretch to limits and then took a decision that, okay, now it's time. I cannot bear this anymore. I'm getting ill. Started having uncontrolled blood pressure. So it's time. I need to move on. So it's time that, this person need to be admitted to a care home. And definitely this person could not have been managed at home. The patient never allowed any caregivers to enter home to support care at home, and even a helper, somebody to even a relative to come and help at home also. So this is another scenario. Again, a person with dementia left home, took a bus, got lost. Now the caregivers continue to worry. And then there is, of course, the person is found after 1 or 2 days. There's one instance, person was found after 15 days. In one case I saw in my private clinic a few years back. Then caregivers have the guilt that they should be blamed that they did not look after this person well. So there's a guilt for the caregivers. And then ultimately what happens in these cases, in these kind of scenarios, the caregivers, because they want to ensure that they no longer have any guilt, or they have to do some, they have to take some action, this person may get locked up at home. So similarly, there are incidences where caregivers are finding it difficult. They start providing care initially with enthusiasm, and then gradually they realize that it is tough job, and then they seek help of their siblings. If there's adult child, siblings, if a spouse, they try and get help from siblings. I won't say siblings, but children, adult child. And then the children, again, they discuss among themselves, among their brothers and sisters, and there could be consensus, and there may not be consensus. Some people may find it very difficult to manage. Some people agree that, okay, for every consultation, I will take this person to the consultation. Now you take care at home. Okay. So we will share all the costs related to caregiving at home. You have a bigger house than us, so you take care. So many things happen. So caregiving is not an easy job. It's a tedious job. It can take toll on patients. And then, for example, if the person is depressed, apathy, where the person is not able to show any emotions. The problem in some of the caregiving is that there may not be any gratitude or kind of thanksgiving from the patient. A person with dementia will never understand he's being cared, or he or she is being cared for, and never be able to show any gratitude that, thank you, you've been looking after me, thank you. So when there is no reinforcement for the caregivers, this also can lead to a kind of, why I'm being punished, or is this what the life is all about? And when is this all going to end? I'm finding it difficult. I'm getting frustrated. Now I'm not able to concentrate at work. Now there's one incident where a person who wanted to migrate to Canada. He's the only son. We arranged for him to have a caregiver at home. He was in Canada. His wife and children were supposed to move to Canada. Mother, a teacher, had dementia. It was getting difficult for the family members, especially the daughter-in-law and children, to manage at home. Once she became very, very aggressive to the extent that she was threatening towards children. This hurt the daughter-in-law, and daughter-in-law decided that she cannot have a mother-in-law at home. Then son calls me from Canada, says that what to do. We have a care home. You want to consider admitting there? You can. You can. You can get admitted there. So, and then he asks, so is it the right thing to do? I'm the son. I'm supposed to look after my mother. What am I supposed to do? Then the issue of, well, what will happen if you migrate back? You return to India. Are you going to be satisfied with your job that you're going to have? Have you got enough opportunities here? And this person clearly said, no way, I won't be happy. So what if your mother was well enough? What would she would have advised you think? So she would have seen me. She's a teacher, and she would have seen me progress in my career. And this is the best opportunity I have. And my wife also will get a job here, and the whole family is going to be, well set here. So now it's your call. If you come back, you won't be happy. If you are not happy, how can you take care of your mother? And you won't have enough financial resources for managing your mom. So it's your call. You decide. So then ultimately he decided that this person need to be admitted to care home, and she was well managed. And there are times when he returned and took the mother home to live with her for months together. I mean, for 4 weeks to 6 weeks, and then he returned to Canada. And then so this is what happened. So it's difficult to give up everything and caregiving, and many people do that. I can remember one senior colleague of ours, a psychiatrist, who at 60 got retired. He could have easily got a job in another medical college because he can work up to 70. But he decided not to work. He decided to care full time for his mom. So it's a kind of sacrifice people make and decide what they want to do. Now, while the caregiving is taking place, the caregiving is happening, there are stages how person goes about. Initially, there's boundless energy, enthusiasm, feel good, I'm doing my job. And then there's a stage where they start having disappointment, saying that, is this, they question their competence and their ability, and they start losing their self-confidence. And then there's something called as brownout stage. Then the caregiver's early enthusiasm and energy gives away. There's chronic fatigue and irritability. They become indecisive. The eating and sleeping patterns change. Some people can get into this smoking, drinking, drugs, partying. They try and find ways to go out and enjoy and come back. So these are maladaptive coping mechanisms. Then there is full-scale burnout, where they get exhausted physically, emotionally. They can have emotional breakdown. They can have depression, and there's a fear that they lose their loved one soon, and they become lonely. And then, like I mentioned, caregivers can get depressed. There's low self-esteem, low self-confidence. And then again, later, when they continue, they adapt. Many people adapt, but invariably, what I have noticed in my practice is that full-scale burnout stage, there is some kind of decision making, whether to move the person to a care home or anything like that, something like that. And So this will get to the stage where they decide. So with this, I put a full stop, and no, I won't say put a full stop, a comma. I will want to discuss if people have any questions, and we can make it interactive. And I would want people to share their experience. They did not mention all of the details, but if they're okay, they can share with the group. Yeah. And Madam Ann.
This is Dr. Mahesh Madri from Abu Rajasthan. Sir, are you able to listen to me? Dr. Harbishettar?
Yes, sir. Yes, sir. Yes, I can hear you, sir. Please tell me.
So it was wonderful explanation, but there is no end to discussion. What is important is a systematic study of reviews that what will work out for prevention or management of caregiver burnout. That is very important. Everyone wants to know how to manage their burnout. So, like if you see, just if you just to quote, like take slow deep breaths, use aroma treatment, drink like herbal tea, meditation or pray daily, exercise, and talk to friend and share their feelings, practice gratitude, listen to music, go outside, massage for tired muscle, stretching and yoga, gardening, coloring, and brain dump with write it down on a paper, whatever difficulties that they face. Watch or read something that makes you laugh, and hot bath, shower, or spa. All these are things, systemic interventions to take care of caregiver burnout. So this is very important. What really works out? Everyone wants to take care because there is only one. Like there are two kinds of caregivers, formal and informal caregivers. This is all we see in the society, but both are exposed to burnout. So in such situation, what works out for them is very important, and interventions to help this also is very important. That should be discussed more and more, and that interaction should be there.
Unfortunately, none of the caregivers are given any formal training, so nobody will know how to start caregiving and where will this all end. And there'll be uncertainty also. If the particular problem is well known, then that's fine. But this is where the physician who is seeing the patient should also, and in many cases they do, as part of the multidisciplinary team they do, and they also work with the caregivers. And if the caregivers are given enough information of what to expect, based on that, the caregivers are also need to be prepared. And the caregivers burden or caregiver stress to be assessed. Sometimes caregiver stress tells us the intensity of the problem in the patient. So the severity, for example, it may be dementia, it may be the problem with this behavioral problems in dementia. The intensity or the severity will tell us that is reflected in the caregiver's stress. So routinely, I usually in dementia, I use the acronym ABCD. A is the activities of daily living. B is the behavior problem. C is the cognitive decline. D is the distress in caregivers. So it's part and parcel of dementia assessment that distress in caregivers is also assessed. And based on that, interventions are planned. If there are no caregivers, likely that even a small risk at home, patient may need to be moved to care home. For example, if the person is living alone and has got mild to moderate dementia, it's unlikely that they can manage on their own at home with gas stove, cooking themselves and making tea or making, things. So it's very difficult for them to manage at home. So yeah, anything else? Anybody else wants to?
Like what I want to know is you are the part of NIMHANS team. So Vayomanasa. So what I wanted is just in Bangalore itself, if there is a data which can be created, like a number of caregivers that are working in, or like doing a lot of caregiving in Bangalore. So their team, for them, the team can be arranged for counseling and other things. Some kind of services can be planned properly.
Yes.
That data
Yes.
has to be maintained. And also,
Yes.
like in Rajasthan, where I'm staying, there is Asha, like one NGO in Jodhpur. They honor caregivers every year. Those are working for 1 year, 2 year, 3 year, they're taking care of their parents, grandparents. They honor them. Such kind of
Yeah,
activities
fantastic.
will be also there in Bangalore.
Very useful information. Okay, so for the current discussion, I'm focusing only on the family caregivers, but yes, even the paid caregivers or the trained caregivers, where I had worked previously, there also they can get burnout. And what we have noticed is their absenteeism. They decide to quit the job. They want to go back to their families. The caregivers, they quit and they go on leave and they never come back. So attrition is very common because of this issue. Then what we did was we arranged for a self-help group kind of a discussion on a Friday, maybe 2 to 3 o'clock, that all caregivers, they log in and one person will discuss their case and how others help them to understand how they can manage and help them. And so these kind of things we arranged, and this actually helped, and they carried forward for many months, I think. And I don't know what happened ultimately, but this is one of the ways that you need to get caregivers on board and have a meeting. It's kind of a self-help group. Like, you're not the only one. I'm also in the same boat. This is how I do in this kind of situation. This is how I do. So why do you bother? Wait. All these kind of things are discussed in that group, basically.
That's nice, doctor. I mean, this is Jambunathan. Can I go ahead, doctor?
No, I'm done with my presentation. So it's all interactive. So I would want people to share their experience.
In fact, I mean, only experience, doctor, you want, or I mean, any suggestion or thing we can ask?
You can share your experience if anybody has had an experience of caring for a ill patient. It may be even for a person who was ill only for a month or 2 months, even how did they find it? So that can be shared.
Excuse me, can I share my experience?
What's your name, ma'am?
Yamuna.
Okay, please do.
I had the experience of taking care of my father. He was bedridden, before he passed away for about 3 months. I understand what you are explaining, and I know how difficult it is. I experienced the burnout that you are mentioning, because you have to do all the physical work of even a smaller one. We ourselves will develop the strain, the physical strain, back pain, unable to even sit for a while, because you will be all the while stressed of the need of the patient, because he was my father. So you cannot rest when they want what they want at what time. We don't know when they will, request. So your sleep gets deprived, and sometimes your appetite goes down. Unless you have another support, it's a tough job. I was recalling all my experiences. Thank you, doctor.
Thank you. Anybody else, they want to share their experience? even a simple surgery, if their spouse or their parents got admitted for surgery, how was the experience during that time? How was the caregiving during that time? Even you can start from that.
Yes,
We can
sir.
understand.
I can
Yes, sir.
I can say that, Dr. For my wife was admitted for replacement of the knees. So,
Yes, sir.
see what was the for 4 or 5 days she was in the hospital. Of course, in the hospital we got help from the nursing staff. Then once she is discharged from the hospital, we were told for 45 days she cannot do anything. She has to be fully taken care of. So, this is, the household duties has to be maintained. And at the same time, various medicines have to be given to her. And she has to be taken out for walking, in a very limited way. And see, there are many steps in the morning. Somebody will come for physiotherapy exercises. So those exercises, we need to ensure that this lady does, because it will be very painful for them. So this way, I was feeling, yes, because of the relationship, I think, and I also got some support from my daughters. We were able to manage. But I think a little amount of training in this, if there is any institute or anything like that, who can give that kind of a training to manage this, that would be very helpful, doctor. That's only my submission. Thank you, doctor.
Thank you. Madam, you also say, Madam also said, yeah, please.
Training, caregiving comes like it's a sudden issue in the family. I don't know who will pre-plan to go and get training for caregiving, unless you decide to take it as a profession. But then in a family, the crisis happens, all of a sudden, and one should have the mindset to help a parent or sibling, whoever is ill, unless you have the compassion and a desire to help. And what is the bondage level that you have with the person with whom you want to take care of matters than anything more. Only then you will be able to give yourself to take care of that person. So actually, it all depends on the family bondage and how much you have developed that love and affection between yourselves. That matters.
Yes.
Something yeah, please, ma'am, please.
Yeah, I am
Madam, you want to say?
Sanchita. Yeah, I am Sanchita. Sorry, I joined a little late, but I understood what you said, doctor. Actually, my experience is, I am myself 65 years old, and my mother is 88 years. 2020, she was admitted in hospital for corona, and now she is alive, but she is having that, we are feeling little dementia process. Frequently, she is forgetting medicines, so many medicines, and she was previously a very active lady, but she has struggled all this corona. That's why she is still managing. But how I managed her, when she is based in Calcutta, and she feels very sad that she has to leave Calcutta and stay with me. And when she was here past 8 months, what I did, occasionally every night I have to go and see whether she is awake. And every now and then I have to see whether she is taking throughout the day, like 12 medicines she has to take. For heart, lungs, she has a patch on lungs. So I have to remind her, she is forgetting. I have to remind. Sometimes I lost my patience, but till I reminded her, and every night 2-3 times I have to get up and see whether she is sleeping or what she is doing. I used to feel very tired, but at the end of the day morning, it is my happiness. I used to feel that I'm happy to serve her. I want to say that we have to empathize with the people, aged people, not only to show them sympathy, just to empathy, to understand that we also will come to that age one day. So to look after them is our duty and to serve them happily. Though we feel tired, I think, but we have to keep our patience very high and to engage them in whatever way. She used to like games, so I have to engage her with games to see whether she can play some memory game and something. To observe her, I have to make her play some games, memory games and all. Like that, I felt that okay, she's at least in one stage only. No, not to make her more deteriorate with her that condition. Now she went to Calcutta. My brother went to Calcutta, but she is not getting that much attention maybe. So after staying there 2 months, she is telling again, I want to go back to Bangalore to daughter. She's telling, because she feels we were thinking that we are giving her attention. Thank you, doctor. This is my experience.
Thanks, madam. Thanks. Mr. Jambunathan, you want to say something?
Doctor, I have already shared my experience, doctor. That is, I have already shared. I was just taking. When somebody was mentioning that, okay, see, because of the love and affection only, we are taking care. But just because I have love and affection, that does not leave me without burnouts. I like to protect against burnouts also. In that context only, I was just thinking if some kind of training is available, it will be very good. That's all. In that context only. Of course, the doctors, even before discharge, they just told us these are all the things you learn to take care. So all those things, yes, in every family there is an elder. See, I am already 75. So I have to take care of another person who is 80. Like that only it's going on. So this is the only, that is why the burnout or the difficulties come. Therefore, in that context only, I was just thinking if some kind of inputs or training is available to take care of the caregiver, that will be useful. That for context only I said. Thank you, doctor.
Anyone wants to go next?
Doctor, I have a few questions that have come, so I'll just share that with you.
Sure.
First of all, some people don't even know what it is to go towards burnout, what really burnout is. They may be experiencing it, but they're unable to say that it is burnout. So if you can just give a few symptoms wherein, people can recognize that it is happening to them or they're leaning towards that side.
Yeah. Getting irritable, angry at, getting snappy at even minor issues, then not getting sleep, thinking about the person all the time, not able to concentrate on their work. So feeling emotionally drained out, exhausted, tired, fatigued, not getting any pleasure in anything, then feeling helpless. So these are all part of burnout. Most of the symptoms overlap with depression. However, because it is specific thing related to that, because the minute or within few weeks of the discontinuation of the caregiving role, the symptom may worn off in most cases. So this is why caregiver burnout is the term specifically given. And we know that if something could be done, that a professional team of caregivers can come and help this patient at home, if they had enough resources, then the family caregiver may not have had that problem. And if there are 3 or 4 children and they take turns and they do it, probably they may not experience any burnout. So it's usually the spouse or one child who is taking care of the person for a prolonged period with ups and downs. and sense of responsibility, then see more burnout.
Thank you, doctor. Somebody else asks, how can I de-stress when I don't have a backup?
There are professional caregivers, they are trained caregivers, and even our team, NIMHANS team, as well as the place where I was working before, had caregivers they used to provide at home. They come and live with the patient 24/7 or the family 24/7. They also had 12-hour shifts, 8-hour shifts, but because of COVID, coming and going can be risky, and then they stop that for some time. They may restart, but so for example, if the person is taken care of for 12 hours, taking the patient, a person with dementia, for walks and spending time with the person, there is stimulation, and that helps. And during that time, the son or daughter-in-law, both, they can go and work and then come back by evening, and then they're okay to look after at night. So there are opportunities, there are other alternatives available. So where trained caregivers who are dedicated for this, they come and support. And there are many agencies in Bangalore. I don't know about many other places, but Chennai, yes, Hyderabad, yes, Delhi, yes, but not many places have this at this point in time. This is where some of the bigger hospitals, they are thinking of, well, you don't need to be in the hospital. You just stay for first 3 days in the hospital. The rest of the care can be given at home. And we send nurses to check up on you. They come and stay, or they can come and stay with you. And they have collaboration with paid caregivers. See, there are types of caregivers again. There can be a nurse, a trained nurse who can become a caregiver. Fantastic, but they're expensive to have at home 24/7. And they can even have set up an ICU at home, because if they have got a ICU experience, they can do very well at home. So for some people who are chronically ill, who can be taken care of even with ventilator at home, that is possible. Some people prefer, they want to spend the last days of their life at home in the same house which they built, in presence of this family and in presence of so many people and all that. So again, that can be arranged the way, because even if you look at, I mean, death is usually not discussed quite easily, but that also requires a lot of discussion. And dignified death is also very important. And the choosing death is also very important. How, what kind of death is preferred, and what is the way and all that. So you cannot just ignore and say that that's something I don't want. So that is also very important. Yeah.
Thank you, doctor. On the chat, we have a question. To take care of somebody else effectively, caregivers have to take care of themselves. How do you think caregivers can be supported in that aspect?
Okay, like I mentioned, caregivers can have, for a set number of days, they can have caregiver at home, a professional caregiver at home, or for every 2 or 3 months, the patient goes into a care home for 2 weeks or 1 week and come back. That will help the person to do whatever they want to do. Having caregiver at home 24/7 is an answer, is a straightforward answer, because they are trained caregivers. And if the spouse is taking care of the patient, for example, a wife of the patient is taking care of the patient, this wife, if they have rich children, the best they can do is empower this wife. Give this wife, this lady, whatever she wants. If she wants maid, give her a maid. If she wants, equipments at home, give them. Make it easy for empower this lady. Very simple. And give her support and say that now 2 days you take a break. I will come and look after my dad. Mom, you go have fun. You go to this marriage and come back. So something of this sort need to be discussed and agreed and sorted out. So you cannot just ignore and leave the caregiver. So if this can be done on every Thursday, you go to temple, or on a Sunday you go to church, such things, and you spend time with your friends. And if there's a husband, not just only husband, go for a drink, but you can go and socialize with your friends and come back. In the meantime, your wife will be looked after by, I'll be looking after your wife and my mom. So you can go, you can take a break. So giving them break and supporting them and empowering them. They can be given equipment. So okay, you watch some TV, you watch these movies, and all that. So empowering the caregiver is a very easy step. That is usually missed. They're confused. All they can do is sit with mom. Mom, I'm there with you. You are looking after my dad. I'm there with you. You tell me what you want. I will, I'm there. Some of these words will help. I'll come and look after you. I'll come and ask, how are you? How are you? So you don't get burned out. See, caregiver not getting burnt out is benefit for the patient. The minute the caregiver starts having burnout, the inevitability is hospital admission or rehab admission or an old age home or a care home. Or even we don't know to what extent caregiving can go to. We don't know. There are literature. There are reports saying that they stop giving medication. We don't know. There's no way of finding it out, right? Let's not get into that, but we need to understand that is also possible.
Thank you, Doctor. There's a question regarding are there any
There was one
forum?
report in Bangalore. I don't know whether you had a chance to read that in newspaper. A caregiver, a mom of a special needs child, pushed and thrown from a building. Special needs child. So the frustration can, it can lead to that stage.
Yeah, doctor.
So for that, unfortunately, not much was discussed, and it was repeatedly said as she killed. It's
Yes,
a homicide.
doctor, I remember
But
a dentist had done that for her daughter. Yeah,
yes, sorry, sir.
Yeah, see, in fact, I remember, doctor, a dentist has done this for her daughter. The daughter,
Yes.
see, in fact, I was surprised how even a doctor, dentist is basically a doctor. So even see, to that kind of burnout could happen. Yes, I understand that.
Yes. So what I'm saying, I don't know about the case in the whole thing, but caregiving is not an easy job, is what my message is here.
Intolerance is a main thing.
Yes, sir. Yes, sir.
Intolerance, because all are human beings. Here, doctor or any superior officer or inferior officer, all are human beings. The limit of tolerance exceeds. Such things are happening. Thank you, doctor.
Thank you for that comment, Tangaraja sir. Doctor, there's one more question. Are there any forums for caregivers to share their experiences or grievances or to seek help?
Some particular illnesses, epilepsy, for example, or they have their associations. So Parkinson's, multiple sclerosis, they have their association. Huntington's disease, they have their association. So they discuss these things in their association, but it's a good idea to have a forum of their own. They have their own group. So I am not aware of the social work team may have some, but I need to check, but I don't know. But there will be. When I was in UK, there were many. There were many, I could say. Yeah, and it helps. It's important.
Mr. Arun Shori's book, Mother's Pain.
Yes, sir. Yes, sir.
It's a very
Dr.
good
Mahesh
book.
will come to you in a minute. Yeah.
Yes,
sir.
Mr. Arun Shori. Have you
Yes,
read?
sir. Please tell me, sir.
Mr. Arun Shori. He has written a book,
Yes.
Mother's Pain, because his
Yes, sir.
child is disabled.
Yes, sir.
He himself and his wife is taking care of with all pains. He has released a book in IIM Bangalore. I have attended the meeting. The book is very, very useful for caregivers.
You have similarly you have dialysis. Similarly, you have anti-cancer treatment that you need to go every often to the hospital to get treatment. Transport, taking the person who to the place and then returning, bringing the person back home, caring for them. So it is. We need to understand the difficulties here, and this is where the last article I wrote in the newspaper was prepare for old age. So even we're 40, 50, I think we all should prepare for our old age. We should not expect. First thing is we should not expect from our children, but we should have our own plan to begin with, and have many people caring for us, or we should have cared many people so that they return the favor and they come helping us for in the future for us. So we need to have a lot of friends and family, and we need to be create bonding with the family and friends. So we cannot be, although we are now nuclear families, only husband, wife, and children is most common now. Although the joint family system has gone out, but still there's no harm in having that kind of a bondage with they still live differently, but still they can come and help, and even friends they can be of help as well when you need. So we have to plan our old age. So we need to understand that we cannot be like, I don't know whether in Kannada there's a movie Bhutaya Namagayo, and he was very cruel, this guy, this Bhutaya, and he used to give loans to people, and he used to trouble people to repay the loans and things like that. And he all his life he did that, and when he dies, the whole nobody in the town comes for his funeral, and the sorry state for a son to take him in a bullock cart and take him to the to bury him and all that. So so we need to plan for old age. So for those who are already old, still we don't know the lifespan we have. It may be 90, 95, we don't know. It may be 100 very easily for many people. So if you don't plan after 60 what we are going to do, we are losing 30, 40 years of our life actually, which is almost half of our life, the major part of our life, where we are experienced. We have a lot of talent. We know we have a lot of 60 plus, they have a lot of experiences to share, and they can be of so much help to the community. So it's important that that at some point the caregiving also will be an issue, because after 85, if somebody has lived up to 85, either you are a caregiver or a person with dementia. So if there's a spouse, one person will be caregiver, one person will be having dementia. So we ourselves have to understand this, and we have to discuss, and this discussion has to take place regularly, and we have to acquire the required skills here, I think.
Thank you,
Dr. Vijay, what I wanted to share is
Yeah, please, Dr. Mahesh.
Are there any caregiver training institutions in Bangalore?
When you say caregiver, are you talking about formal caregivers or informal caregiver? In the sense, the family caregivers.
Caregiver training institution means they should know in and outs of caregiving, because when caregivers don't know how to take care, even small things, they get stressed. That is a cause of burnout. Most important.
Yeah.
So
Yeah.
that is why
For
now
geriatric,
a lot of literature is coming up, how to take care of elderly, small things.
yes.
How to give them feeding, how to give them tablets, how to give them medicine, different skills. They needs to be trained. So now in Rajasthan, Professor of Geriatrics, Dr. Arvind Mathur has written a beautiful book on caregiving, and he has got a Geriatric Ratna Award from Padma Shri V.S. Natarajan. And like that, there should be some Kannada literature also should be available for caregivers in Karnataka in Kannada language, like how to give good caregiving for elderly. With small skills, they should be trained through literature.
Yeah, I'll tell you what. Our geriatric team, headed by our Professor P.T. Shivkumar, we have launched caregivers training program in NIMHANS. And already, I think about 200 people have already been trained, and they're certified. So this was from some funding from some organization, I think, CSR funding, and this will carry on. This will continue, and this is for professional caregivers. Although where I worked before, one of the organization, they had their own in-house training for these caregivers. They used to get people who were +2 pass, and they used to get them here, and they used to train them. And then after training, they would leave these patients to manage at home. So now the NIMHANS Geriatric team, of course, in collaboration with, in discussions with these organizations, some of these organizations have started doing it. So you welcome to spread the message that we will need people who want to avail this, this training program. So we need to publicize this more so that more people can come and get training here. This was online training because of COVID reasons. There's a possibility of level 2, level 3 kind of in-house training also is possible, with some internship, with some collaboration with care homes is possible. Yeah. Somebody wants to say something. Hands
Some
up.
private institution, I learned this one, geriatric counseling, they given a course for 3 months, and there I attended geriatric counseling, private in Artinagar.
Yeah. So yeah, geriatric counseling is available, but caregiving is something that needs to be looked at.
Vijay, can I come in?
Yeah, please.
This is Professor Srinivasa Murthy speaking.
Yes, sir. Please, sir.
Okay. I just want to share with you, since the topic of caregiving, particularly of the special children, was come up. We at the Association for Mentally Challenged, that is just next to NIMHANS, have been working on a caregiver support program for the last 2 years. And we have a one-day training program for caregivers of children with developmental disabilities. That is both mental retardation and autism. It is from morning 10 o'clock till about 4 o'clock. I'll briefly tell you what it is, and I'll be very happy to share that. We have a Kannada manual, we have an English manual, we have 10 videos to go with it. Basically, what happened was that when we studied the parents of children with special disabilities, special needs, we found that the prevalence of emotional distress was about 5 times that of the general population. And there are about 30 articles from India alone showing that one. Then we understood that, and then we offered them a online service that I said I will give my service free of cost, but no one took it. So then we went back to the drawing board and said, what can we do? Then we identified 2 skills that are very important. One is to become stronger. Second thing is to handle the day-to-day emotional distress. And we identified 5 things they can do, which are evidence-based, 30 minutes of exercise every day, 8 hours of sleep, meditation, yoga, nutrition, fiber-rich fruits and vegetables, and being connected. These are all evidence proven. We have a handbook. We'll be happy to share it free of cost to anyone. Similarly, when they have distress, worry, all the things that you talked about, we taught them 5 things: sharing your feelings, journaling, doing pleasurable things, thinking differently, and spirituality. And we do this not by bodhane, but sadhane, by activities from 10 o'clock till about 4 o'clock. We have done about a dozen training programs like this, and we are hoping to train all the NGOs of Karnataka staff to do this at their own level. And we have the manual in English and Kannada. And also we have each one of these activities as a 5-minute video in Kannada at this moment, and soon we'll have it in English, which we again will be happy to share with them. Now, the last thing which I want to share is that if anyone wants to get in, please, I'll put my email just there. You're welcome to get in touch with me. yesmurthy030@gmail.com. I'll put it in the chat after I finish talking. In addition to that, caregiving is a very challenging experience. Recently, Dr. Arthur Kleinman, he is from the Harvard University. He had to look after his wife for 10 years with dementia. And he has written a beautiful book, The Soul of Care. And he says that in spite of my 50 years of experience as a psychiatrist, caregiving was a new experience. Now, the point which I want to make is that we must, the point which many authors asked, many participants asked, is there any caregiving? As soon as you become a caregiver, you should go for this type of orientation, learning the skills of strengthening yourself and handling your emotional problems. And this is at this moment available to the caregivers of the parents who are looking after special children at AMC. But if necessary, we'll be happy to come and share this experience, both in terms of the, not just as a saying that do this, but we give them an opportunity to experience it. And I'll be very happy to be in touch. My team, we call it as Enrich, empowering the parents with knowledge and information for holistic living. You know, Enrich is the project, and I'll be happy. I'm putting my email. Please get in touch with us. We'll be very happy to share all of the experience with you. Thank you.
Thanks, sir. Thanks for useful information. So with wealth of experience, it's useful for people like me, your student. So from my audience. So thank you, sir. And over to you. Unless if people have any other comments, it's over to you.
So there's just one last question that I have. I think we can take that. It says, how does a caregiver manage third-party advisors and comments?
Some may be useful, some may not be. So it's double-edged sword. So we don't know. It may help, it may hinder. I don't know. So some, third party may say, okay, go to this faith healer. So what you'll do? Or go to this Jyotsi. So I don't know whether, I don't know. We don't know. So
can I come in just for one more minute?
Please.
Yeah, just
please
one more minute. One other thing which I want all caregivers to remember, there are 3 challenges that every caregiver faces. The first challenge is the novelty crisis. The second one is the reality crisis. More than these 2, we have talked a lot about these 2, but more than that, how do I make sense out of it? What do I call it as the value crisis? And I think in India, we have a lot of rich tradition of being able to understand suffering, pain, burden, whether you take Mahabharata, Ramayana. As a matter of fact, in our work, we use a lot of the stories, like the story of Kisa Gautami, the story of Parikshit in this end-of-life situation, or Kunti, when she says to Krishna, give me trouble so that I'll remember you. I'm not saying it as an easy solution, but I think we need to build upon that. And so we need to help them to understand the illness, have the skills to take care of it, and more than that, make a sense out of it, grow out of it, find a purpose in it. Very interestingly, of all the things that we noticed with the caregivers of parents of the special children, the spiritual resource is the one which they used most. It came as a surprise to our team itself. So I think we need to go back to not just to say that, look, devar mele bitbidi, ella saru hogute, and that's not the thing, but help them to process the things so that they can grow out of it and they feel better. There are two excellent books, those of you who are looking for Indian books. One is called Krishna by a professor of political science, written about his wife with dementia. Other one is Meenakshi Chowdhury. She has written a book called The World Within, talking about her father who was a Sanskrit professor with dementia. Excellent books telling the day-to-day problems and what needs to be done. I think more and more of us will have to come forward to share not only the burden, but the purposiveness. For example, I'll just tell you one other lady whose father developed aphasia. And she gave up her job and started using, he was a Sanskrit professor again, using the shlokas to teach him to speak again. And in 2 years' time was able to achieve quite a bit of result. So there is a tremendous lot that is occurring in the community. I value the caregivers enormously. And I think as professionals, as Vijay has been talking about it, we must empower them with skills to take care of themselves, skills to handle the problem, and find a purpose and meaning. As Sri Swami Ranganathananji says, don't look at it as a loss, think of it as a transition. Think it as an opportunity for growth. I hope I'll be very happy if anyone would like to get in touch with me, send me an email or come and meet us at AMC. We'll be very happy to work with you. Thank you very much.
Thank you so much, Professor Murthy. That was really nice of you to share. Thank you, Doctor. I think we don't have any more questions as of now, and we've also run out of time, so I think we can close here. Thank you so much, Doctor, for the wonderful words that you've shared with us and all the insights. Thanks to all the participants who shared their experiences as well. I'll hand over back to Annapurani.
Yes, thank you all. It's time to end up this session. Really, we had a wonderful, insightful session, which has been headed by Dr. Vijay, Assistant Professor NIMHANS. Very interesting session you have given us, and very good information we have got it from you, and you have shared your elaborate experience. Thank you so much, sir. Thank you, sir. I also extend my heartfelt thanks to Ms. Annie Matthew, who moderated the webinar today. Thank you, ma'am, for your presence with us. Thanks a lot. My deep gratitude to all our Zoom and YouTube participants. So whomever has questions can mail to us. We'll definitely reach to you back. I also thank our partners, that is the Government of Karnataka, Government State Legal Service Authority, Bangalore Apartment Federation, Happy 60+, Indian Psychiatric Society Karnataka Chapter 1, REC Foundation, Samadhana Counseling Center, Icon Life Sciences, NSC Foundation. So with this, I wish all a wonderful evening. Thank you all. Thank you once again.
Thanks, Doctor. Excellent session. Thank you. God bless you.
Thank you, sir. Thank you very much.